Hi, my name is Sarah Hyland and I'm the diabetes educator here at Minnesota Community Care. I'm here to talk to you today about gestational diabetes. Gestational diabetes is a temporary type of diabetes that is first diagnosed during pregnancy. During pregnancy, the placenta is the organ that secretes many hormones. And as the pregnancy advances, some of those hormones can cause blood glucose levels to rise, making it difficult for mothers to control their blood sugars. And elevated blood sugars can have health problems for both mother and for the baby. And we here at Minnesota Community Care are devoted to helping you have a very healthy pregnancy and a very healthy baby. We will be a team with you to help you manage gestational diabetes and help you get your blood glucose levels to a safe range. Here are 3 ways that we will help you manage your gestational diabetes and help you bring your blood sugars to the safe range. The first way is through your diet. Stop and think about how you're eating right now. And think about that pattern. And what I'm going to recommend is that you begin to eat smaller portioned meals throughout your day. I recommend 3 meals and 3 snacks. And I want you to allow 2 to 3 hours between those. Next, I want you to learn about the carbohydrate containing foods that are in your diet, because these are the foods that do raise blood glucose. Here are some examples of what we have that are carbohydrate containing foods. The first are grains such as corn, potato, beans, rice, cereal, bread, and tortillas. Another form of carbohydrate are fruits. Another form, milk and yogurt. And another form are our sweets. So whether it be donuts, ice cream, cookies, or whether we add sugar to coffee. These are all ways that we incorporate carbohydrates in our day, but we may not be aware that they are raising glucose. So I'm going to ask you to start thinking about a portion. So maybe you were thinking, I eat about 2 cups of rice at my meal. And now we're going to talk about reducing your portion to 1 cup of rice. And what does that look like? If you reduce your portion to 1 cup of rice on your plate, what is going to fill in here? I'm going to recommend vegetables. And the reason I'm going to recommend vegetables is because they offer so many benefits without raising your glucose. You'll get water, fiber, vitamins and minerals, and all of these are beautiful for you and your health and that of the health of a growing baby inside of you. So that's the next way, is to portion your carbohydrates. And then I'm going to recommend water. Drink water. Drink water at your meals and the snacks that we just talked about. And what you want to avoid are the beverages that can raise your blood sugar, such as juice, sodas, and any other sweetened beverages. Those are the beverages we want to avoid. And look again at water. The second way that we can help you manage your gestational diabetes and help you control your blood sugar is through physical activity. So again, think about your day and work to find 15 to 30 minutes to move your body. And that can be in walking, dancing, whatever aerobic activity that you enjoy doing. I want you to connect with that and spend time doing that. This is going to help you lower your blood sugar, and other benefits are you're going to feel better, you're going to sleep better, and it's going to help you maintain a healthy weight throughout your pregnancy. The third way we're going to help you manage your gestational diabetes is to teach you how to use a glucose meter. A meter will be prescribed to you and you will be shown how to use the meter. And it is through the meter that you're going to be able to evaluate how your changes in your diet are going and how your physical activity is positively influencing your glucose. To begin testing your blood glucose, you want to set up the Lansing device. I have mine set in 1 so that it's a very light finger stick. I'm going to remove the cap by placing 2 fingers to the side of the button and 2 fingers to the side of the arrow. I'm then going to toggle and pull the cap away, thereby exposing where I can put my lancet. I line the line of the lancet up with the line in the Lansing device and connect it so that it's at the base. Once at the base, we're going to twist the cap off and save the cap for later use. We're going to connect the arrow side of the cap to the button on the instrument and click it in place. Once that's together, you want to draw the back side of the Lansing device back, thereby pulling up the trigger button. The Lansing device is now ready. Then I'm going to prepare a test strip, taking 1 strip out and replacing the cap right away. Here is the glucose meter that will tell me my glucose value. I'm going to insert the gray side into the meter, which will then activate the meter and turn it on. It will tell me the time of the day I'm doing the test. It will tell me that my strip is in place and that now it wants a drop of blood. So I will take my Lansing device and I can choose any of my fingers. I'm going to go along the sides of the fingers. It's more comfortable in that area. So I place the circle part of the Lansing device to the side of my finger, depress the button, and I get my finger stick. I'm going to massage from the bottom of my hand to the tip, thereby forming a drop of blood. I'm going to take the test strip and I want to angle the test strip into the drop of blood and let it wick up the blood and hold until the meter beeps. It beeped. Now I wait 5 seconds for the meter to give me my result. And there we have my blood glucose. I will then record that blood sugar level in my logbook. After getting your blood sugar result, you want to record it in the logbook, and you're going to bring your logbook and your meter with you to your provider visits. We would like you to test your glucose when you are fasting, so when you wake up, and 1 hour after eating each meal. Your fasting goal is to have a glucose between 60 and 95 milligrams, and 1 hour after eating meals, you want to have your blood glucose between 80 to 139. So beginning to make these changes, starting today, with your diet, with your exercise, drinking water, and checking your blood sugar. These are all the ways that are going to help you have a healthy pregnancy and a healthy baby. They are also the steps that you are taking to prevent diabetes in your future. We support you. We are here for you. Thank you.